When I sit across from a heart patient in my clinic, whether they've had bypass surgery, angioplasty, a stent, valve replacement, or even early heart disease without surgery, one question almost always comes up sooner or later, and that question is, "Doctor, what should I eat? And what should I never eat again?" And today I want to answer that honestly, clearly, and without confusion by sharing the 3 foods I personally tell my heart patients to avoid completely. Not because I want to restrict their lives, but because I want to protect the heart they fought so hard to save. Because after heart disease or heart surgery, food is no longer just fuel. It is medicine or poison depending on what you choose. And the first food I strongly advise patients to completely eliminate is processed and refined foods, especially items like packaged snacks, bakery products, instant noodles, biscuits, chips, namkeen, frozen foods, and commercially prepared fast foods, because these foods are loaded with refined flour, hidden sugars, trans fats, excessive salt, preservatives, and inflammatory oils that directly damage the inner lining of blood vessels called the endothelium, increase bad LDL cholesterol, reduce good HDL cholesterol, worsen insulin resistance, and silently promote plaque formation inside coronary arteries. And many patients tell me, "Doctor, I eat very little." But what they don't realize is that even small amounts consumed daily cause chronic inflammation, which is the root cause of heart attacks, strokes, and bypass graft failure over time, and after heart surgery especially. These foods slow healing, worsen swelling, increase water retention, and make blood pressure harder to control. So instead of processed foods, I advise simple home-cooked meals with whole grains, fresh vegetables, pulses, healthy oils in moderation, and natural ingredients your grandmother would recognize. Because your heart heals best in a low-inflammation environment. And the second food category I insist my heart patients avoid completely is deep-fried foods, including puri, bachura, samosa, pakora, fried snacks, fried restaurant foods, and repeatedly reheated oils. Because frying, especially deep frying, changes the chemical structure of oils, producing toxic compounds and oxidized fats that accelerate arterial damage, thicken blood, worsen cholesterol ratios, and increase the risk of rhythm disturbances. And many patients are shocked when I explain that even vegetable oil becomes harmful when heated repeatedly, because reused oil contains trans fats and free radicals that directly injure heart muscle cells, increase triglycerides, and strain the liver. And after bypass surgery or stent placement, fried foods significantly increase the risk of graft blockage or stent restenosis. And while occasional indulgence may seem harmless, the heart does not forget repeated insults. So I always recommend safer cooking methods like steaming, boiling, pressure cooking, sautéing lightly, baking, or air frying when appropriate. Because protecting your heart does not mean tasteless food. It means smarter preparation. And the third food I tell my heart patients to avoid completely is sugary foods and sweetened beverages, including sweets, desserts, pastries, mithai, sweetened tea or coffee, fruit juices, soft drinks, energy drinks, and hidden sugars found in sauces and packaged foods. Because excess sugar causes rapid spikes in blood glucose and insulin, leading to inflammation, fat deposition around organs, worsening cholesterol, increased blood clot risk, and progressive damage to blood vessels. And many heart patients wrongly believe that sugar only affects diabetes. But in reality, sugar is one of the strongest drivers of heart disease even in non-diabetics. And I've seen patients with normal sugar levels suffer repeat heart attacks because of chronic high sugar intake. And after heart surgery, sugar delays wound healing, increases infection risk, worsens fatigue, and contributes to weight gain that strains the recovering heart. So instead of sugar, I advise natural sweetness from whole fruits in moderation, controlled portions, and retraining the taste buds to enjoy food without excess sweetness. Because your heart does not need sugar to heal, it needs stability, balance, and nourishment. And as I always tell my patients, avoiding these 3 foods is not about fear. It is about empowerment. Because when you remove processed foods, fried foods, and excess sugar from your diet, blood pressure improves, cholesterol stabilizes, energy levels rise, breathing becomes easier, weight reduces naturally, and most importantly, the heart gets the calm internal environment it needs to repair itself, strengthen its muscle, and protect you from future cardiac events. And if you are watching this video as a heart patient, a survivor, or a caregiver, remember that medication and surgery can save your life, but daily food choices decide how well and how long your heart will serve you. And that is why I am so firm about these 3 foods, because I don't just want my patients to survive. I want them to live longer, stronger, and with confidence.